This stuff. This is a big problem because some companies say, okay, we'll get you set up with the Cobra. You'll branch right back to the stuff that you had before. Cobra's run out. People have to find health insurance. There are real pitfalls out there.
That's right. This is expensive and the details are not easy to understand, Harry. And I would argue that this is actually relevant even for the people who still are employed because most people just do not understand what their health coverage entails. So this really is a very broad scope problem.
All right, Consumer Reports helped us find some of the pitfalls. And one of the things they talk about, spending limits on vital care. What do we need to be paying attention to?
Right, so you don't want any of that. Basically, you want to make sure that these health plans cover everything: diagnostic, imaging tests, inpatient and outpatient care, and rehabilitation. And you have to read the fine print because sometimes they'll say they'll cover inpatient to the maximum, but everything else you're on your own. So
and
you
then
have
you're
to look at
really in trouble.
Absolutely.
Crazy in trouble. All right. One of the other ones they say, look out for the amount of out-of-pocket expenses.
Correct. So what this means is most plans have an out-of-pocket that's usually a couple of $1,000s, after which time they will reimburse or cover at 100% of that. Not every plan considers the same out-of-pocket things to be equivalent. So, for example, co-pays or prescription medication might not be considered out-of-pocket, but you're still paying for them, so you have to check that.
Boy, this is really fraught with peril. I mean, this can be really bad. Affordable, look for the affordable premium or look out for the affordable premium?
Now, we're getting increasingly more complex as we go on. There's no such thing as a free lunch here, and with insurance premiums, you truly get what you pay for. So if you get a deal that sounds too good to be true, it's probably going to be a very slim on the benefits.
And last but not least, watch out for the random gotchas.
This is the hardest. It's truly uncharted territory. A lot of insurance companies will say they cover the second hospital day, but not the first, and you might not know about it till it's too late. So you really want to plan for the worst case scenario. It's insurance.
And it's, even though you're in this sort of traumatized state, having lost your insurance, this is something you really, really need to pay attention to.
You have to look at the fine print. It's a contract and it's very important.
There you go. Look out for the random gotchas.